Hello, I'm Darlene Stromstad, President and CEO of the Mohawk Valley Health System. We're so pleased that you are considering our residency program. Our new regional medical center is being built in downtown Utica. This 9-story, 700,000 square foot medical center will replace our aging hospitals and bring all inpatient care together under one roof. It will feature all single patient rooms with a view of the beautiful Mohawk Valley, a surgical innovation center, a heart center, discrete stroke unit, and state-of-the-art technology. Our move-in date is February 2023.
For the class that's coming in shortly, they will be the first class to actually provide care in the new medical center. That's a once-in-a-lifetime opportunity for anybody to even be involved in a new hospital like this. But to be able to be a trainee and then to stay and work in the area, I think that's a wonderful opportunity.
When you do a residency program, you want to be a big fish in a small pond. This program allows you to stand out. We are an unopposed program, which means here at St. Elizabeth's, you're not going to have other residencies or other interns kind of fighting for the same procedures or exposure to different patients.
What it means is that you're the only residents in the hospitals that you work with. There's no surgery residents, there's no OB residents, there's no pediatric residents. And that's just mean you have that much more exposure to each of these specialties. The growth is just exponential comparing from the time we start to when we are about to finish.
10 years from now, we're going to be about 50,000 primary care providers short in the United States. Only a small percentage of U.S. grads getting out of medical school go into family medicine. That's why it's important that we keep making family physicians. We are still the center, I believe, of the practice of medicine.
A lot of physicians are retiring and not as many coming in to replace them, but there's, if anything, more people than ever that need care. Everybody that works with the program, from the family medicine group to the specialists, they do it because they want to.
Every single day, people entrust me with their lives. They entrust me with their medical conditions, their mental health, their emotional health, and their physical health. And they give me a tiny snapshot of their lives and they let me in, and I get to be a part of that.
For a doctor, we have to deal with a human being, and we need to understand not only the disease, but also each and every aspect about the patient, social life, patient's family, and we have to take care of not only the disease condition. It's a true family medicine program here.
The community has become more of a multicultural community than it was when I was here.
There's a large refugee population within the area, so you get to practice a certain aspect of the medicine that you won't necessarily get to practice in even some of the bigger university programs.
We do see a lot of different things that even some of the big cities don't. We actually have created some pathways and protocols here in our hospital that other hospitals have actually taken and used, which is really kind of unique.
One of the things that I saw when I came for an interview is the tight-knit community that's part of this program. Everyone seems to be like family, and I want to be part of that family.
It's a funny thing how fates come together. I wasn't necessarily planning on staying here, but during my 3 years, I just fell in love with the place.
My favorite part is the people. Everybody here is welcoming, they're nice, they're kind, and if something were to happen to you, God forbid, your community would rally behind you.
So if you don't have family here, the hospital becomes your family, the residency becomes your family. We all take care of each other, we all help each other out. That's what's really nice, it makes you want to stay.
It's super affordable. It's a great cost of living. It's a great place to raise a family. The schools are unbelievable. My kids go to public school here. It's amazing.
I feel thankful every single day. I feel like the decision of coming here for residency was the right one.
This is an exciting time for MVHS and an exciting time to be in Central New York. We hope you'll consider joining us on this transformational journey from excellent to exceptional.